COVID HR and business updates. My name is Pandy Pridemore, Principal Consultant and Founder at the Human Resource USA. Yes, we are back for another week, and oh my gosh, I have got some great stuff for you today. As always, we're listening to your questions, we're taking your feedback, and we're trying to give you information that is relevant and current. But as we have all taken the bumps and bruises on with this whole COVID-19 pandemic, things are changing at the speed of light. So we do have a couple of updates that we're going to bring to you today on the show. We're also going to bring you new information that we have never had on the show today. So I think you're going to enjoy it. And by the way, it's going to move fast. Joining me, not only are we going to have Scott Warwick back, Scott's going to come back, and we're actually going to kind of continue that whole conversation of the ADA a bit, but we're also going to kind of fall back and let's do some refresher on the FCCRA programs, because I'm still getting a lot of questions and concerns about individuals that, well, we didn't mess much with the FFCRA once the PPP loans kicked in, but now that all that money's run out, what's going to happen with some of these individuals that are coming forward and asking questions about exposure and that kind of thing. So Scott's here to help us walk through all that. We also are very excited to have Sarah Kemmer here from the Better Business Bureau, and everybody knows the BBB. Mm-hmm. Everybody understands how prestigious and incredible. Let's talk about what the BBB does for businesses overall. But you will be shocked at what she's going to bring to us today in terms of what the BBB is receiving on phone calls and complaints and feedback during this era of pandemic. And then later in the show, we're going to have Laura Venerable, the Senior Director of Cortot Products from Cortot Health. Now, a couple of weeks ago, if you were with us, you saw a tracking system for COVID-19. It was a great program, one of the first I had heard about, but now I'm aware of Cortot Health's back to work tracking system, which I mentioned last week is so robust and so detailed that those of you with those big organizations of 500, 1,000, 2,000 employees, this is a system you really need to look at. So Laura, we're just thrilled that she had time out of her busy schedule to come and talk to us about this new product. And hey, by the way, did you hear that the PPP loan got extended? I am so thrilled to be able to tell everybody that if you have not heard. So all of those of you who didn't think about the PPP loan or ask for it, that's one of the big things that happened this week. Scott, have you heard anyone talking about this yet?
No, surprisingly not, because they had $1.3 billion left, which to me is like a lot. And I know of folks who have not applied for this. And I'll tell you, I contacted my banker, who I've been with a small local bank. Actually, I worked at that bank while I was going through law school. And so I've been with them for 30 years. And it went right through. I had it very quickly. The calculations were easy. And on top of that, there is if you haven't applied for this, there's no reason not to, because the time period that we discussed on your show about a month ago, where we had this compression problem where you were going to get 12 weeks of pay that you had to use in 10 weeks. And there's this compression problem. It's like, well, wait a minute. How am I going to use this if I don't get people raises and things like this or whatever? What if my other expenses didn't take that up? That's been extended. The time period to use the PPP loans has been extended to 12/31. So believe me, it should not be difficult to use 12 weeks of pay in the next 25 weeks. Okay. So honestly, it's a no-brainer. If you have not done it, man, I'll tell you, later today or first thing tomorrow morning, I would get on the phone, because there's literally $1 billion sitting out there. And I know of a lot of companies that really could use it and have not gotten it yet.
And the extension's through August 8th, from what I understand. So again, viewer, if you have not applied for that PPP, and again, we're talking independent contractors, sole proprietors, we're talking about people like Scott and I who have small firms, you don't have to be a big organization to qualify for this. So like we tell you always, make sure you got a banker in your back pocket and make sure you've got a good CPA in your back pocket, because those two individuals will definitely help you walk through this program.
Well, you talk about small employers. They didn't get any smaller than me. I'm a sole proprietor.
Yeah,
I mean, you see my whole staff meeting right here. Okay, so oh yeah, this is a great, honestly, for business out there. This is one of the most proactive business things ever. You will never get it again, and if they don't use it, they might as well turn around and give some back to Ruth Chris.
Sarah Kemmer from the BBB. You know, no news is bad news for us on this show, because again, sometimes it's good stuff like the extension of the PPP loan, and other times it's things that we need to be watching out for, or things that we're not thinking about. What's going on over at the BBB?
Yeah, so one, thank you so much for having me on the show. I'm very excited to present all the information I have. I wanted to highlight some scams that we are seeing that are COVID prone. But also, I just wanted to go through some tips, reminders for businesses out there and for their clients to ensure that there's that trustworthy interaction within the marketplace, which is basically what we stand for. And as if you think COVID works fast, scammers work just as fast, if not faster, and especially with all their technology skills. So I actually really wanted to I wanted to go ahead and start just by having a little bit of a intro on who we are about Better Business Bureau. People think that we only do just a few things, when in actuality, we do all the things. We do a lot of things. So, and we have been around for ages, all the way back since 1912. So we have literally seen everything. Just as a reminder, our vision is to create and maintain that ethical marketplace where buyers and sellers can trust each other. And I think that's really important in these past few months and going into the future. So there are different components of the Better Business Bureau where you have that accreditation process, which we all see the seal, we see ratings, and that's one of the most pivotal points of businesses and charities. We actually accredit charities as well. So, and businesses and charities don't just sign up for their accreditation, they have to go through a process to ensure that their procedures and practices, they meet our standards and make sure that they maintain that ethical interaction in the marketplace. But then you also have the complaint aspect of the Better Business Bureau. For anyone that has a complaint with the business, people can contact their local Better Business Bureau, where we can help dispute the complaint between the business and the customer, those are very two different things, but they just ensure that ethical interaction. And lastly, we're here just to inform and educate consumers. We never miss an opportunity to help consumers be smart, be safe, and once again, ethical in the marketplace. So there's a lot of components, but they all kind of share that ethical component.
Well, our first conversation was in regards to an email that I got from BBB in regards to some of the complaints that you've been receiving. And I was most intrigued with that, again, as a result of COVID.
Yeah, so we are in constant contact with our businesses all the time. And just to go ahead and start off with, at least I work for the Cincinnati Better Business Bureau, and we, not only just in Cincinnati, but across the country, we're seeing businesses slowly resume. And it's important to ensure that the safety of their team and their customers comes first. And a good chunk of our accredited businesses are in-home contractors or in-home services like contractors, plumbers, maintenance of whatnot, and et cetera. So, and we're sorry, this may be a little redundant if you're watching, and if you're tired of hearing about these details, but it's really important to stay up to date so your customers feel safe. And when your customers feel safe, that is when you create that trustworthy relationship, which then leads to repeat business. So needless to say, these rules are really important. So in Cincinnati, we have seen a lot of complaints about customers being unhappy with businesses going door to door without that proper safety equipment. And as we're still kind of trucking through the pandemic, we're seeing more and more complaints. So I just have some tips when resuming your door-to-door work or in-home repairs and maintenance.
Good.
Yeah, so just, and this goes for leadership teams, maybe executives are watching, owners and clients. So before arriving at a customer's home, we want to make sure that we give them a courtesy call to let them know, hey, we're on our way, or you can give them an allotted time frame. And that just kind of gives them that peace of mind.
Okay.
Then when you arrive at a customer's home, we want to make sure that we are wearing that PPE. We can't avoid it, but things like masks, and something that I never considered are shoe coverings, because as you are going into someone's home, you may be wearing dirty boots or something that you have touched. You really never know. So we want to wear things like masks, gloves, and shoe coverings to ensure the safety of you and the client. And lastly, we want to make sure that customers are aware of any non-contact or minimal contact policies before entering the home. So if you do make contact, we want to make sure that we are socially distant, and your hands are constantly washed and sanitized. And that's how we fight the spread. So also, if you travel door to door, you want to make sure that you have that proper documentation to potential customers, and that they know your name and your company, so they know that you're legit. And it's not just someone showing up to your door. And these door-to-door businesses really should consider the fact that maybe customers really don't want to answer the door due to safety concerns, which is definitely probable cause. Just as we're going through this, I think many customers are very concerned. They want to stay back and just be safe first and foremost. Yes.
Usually after them watching the news.
Exactly.
Yeah.
Yes. Mm-hmm. So
I was just looking here, 900 new cases in Ohio just today.
And it's so crazy how these numbers are evolving. And I know that people are so tired of hearing this. It still feels like March. But we just want to make sure that safety is our number one concern, because if you are safe, that really ensures that the clients are safe, and it really helps with that interaction.
So Sarah, one of the things that I was reading recently was some recommendations from some of the top public health officials. And they were talking about, like, personally, when they were having people in their home for repair and stuff like that, they tried to separate themselves physically while that person was in the house, like to go to their office and shut the door, or to go to an upstairs bedroom and shut the door, which not only kept them safe, but kept that person that was in the house safe as well.
Yeah, so I think something that businesses are maybe taking more caution of is maybe they're having a call with their client right beforehand saying, hey, you can come on in. I'll be in an office. I'll be in my bedroom. Go ahead and do what you need to do just to ensure that safety.
Are you getting any calls about people that, because I've seen a lot of no solicitation signs go up on the homes in my neighborhood. Mm-hmm. I've had one for a long time. Okay. And that didn't seem to work. So I went and got another one from Amazon that says, no soliciting. This means you don't ask me to do anything. There's this definition underneath there. Okay. Mm-hmm. Are you getting calls that people are just ignoring that in spite of this COVID thing, and they're just openly soliciting door to door?
We haven't really been getting calls specifically on solicitation.
Okay.
It's really all about, I think, people just not wanting to answer their door, kind of interact with that business. And they don't really want to be sold stuff, especially during now. So though we haven't really seen complaints about it, if you're able to maybe see if there's like a company logo or something like that.
Yeah.
That's definitely what we recommend if you do have that.
I get a picture of it. Okay. It's like, there's your face and everything. I don't know down in Cincinnati, but up here in Columbus, we're not allowed to shoot them. When they just show up and start, soliciting. Well, I'm being facetious, please. Okay. Because I know I'm, got some other folks out there, but it is, I hate this when they do it ordinarily. Now I am still getting, my office is in my home, as you can probably see. And I am still getting people coming and they want to switch me to something. And it's some company that's registered here in Ohio or something. And I was just curious if you were getting calls that even in spite of COVID, you still get this kind of stuff.
It's so crazy because you would think that businesses like that who do go door to door, they would be slowing down.
No.
Which in some cases they are.
Oh my God.
It really just depends based on neighborhood. We haven't really seen any solicitation by that. And we also haven't seen, but there's also a matter of maybe scammers that go door to door and try to sell like fake products. fake services and all that stuff. So if you do have something that I hope people aren't knocking on your door every hour.
I get one every couple weeks.
Okay.
Oh yeah, because I'm here all day. Because
right, and you can hear them.
But really, could I call up the local BBB and send a picture of this and say, "This is happening to me. These are the people trying to sell me a home security system," which I wish the home security system would keep them away, or new electric or something. That's something you folks could maybe help with.
Yes. So if you are able to see a company logo, we do recommend calling and maybe filing a complaint with that business. You can also look on the Attorney General's website, and they have a big directory of all the businesses in there. So if you are really concerned, you could contact them if you'd like. But also, if you think it's a scam and it's not a legitimate business, you can also contact, we have something called scamtracker.org. And it's a Better Business Bureau database for people to submit their scams if they've been a victim of one, or if they've lost money, if they've gotten solicitations, text messages, so many different aspects. You could submit those scams, and if we see an uptick in certain scams in a certain area, we're able to alert. What I would do is I collect all the information I can, and then I send out an alert to the media. So it's just letting people know, hey, this scam is going around. Just be aware. Here are safety reminders when you have people come into your home, or if you do have someone come knock on your door.
Yeah.
One of the scams that you talked about with me on the phone the other day, Sarah, is one that I really want to make sure that we talk about today on the show. And that's the nice little card that people were starting to circulate. Scott will love this conversation.
I had a feeling he would. So, and it's actually funny that you mentioned at the beginning of the of this is that information is outdated so quickly. And quite frankly, this is outdated because it happened all the way last week. But it's an example of kind of what happens during these trying times. I'm hesitant to say that phrase, but just for lack of a better phrase. So we have seen these phony face mask exemption cards, and they were circulating through social media last week. It's these printable little like business cards that people have been laminating. And we found them on Facebook from an agency called the Freedom to Breathe Agency. And once again, I would like to add, I don't think they exist anywhere. I haven't been able to find them on social media anymore. But they created this card as a claim to be issued by the Americans with Disabilities Act under the Department of Justice. And it's for citizens to be exempt from wearing face masks in public. So people can just present this card and say, hey, you don't have to tell me to wear a face mask, but as most scams are, it's phony and fake. Once again, last week, the Department of Justice and the Americans with Disabilities Act, they made a statement saying that these cards were not stated nor endorsed by the DOJ and the ADA. And
right?
Huh?
Department of Justice. They says Department of Justice has given this to you.
Exactly. Yeah. And that's how it like legitimizes the scam.
Well,
but
they didn't do any research because the Department of Justice doesn't have anything to do with the ADA.
Exactly.
It's the EEOC. It's the Department of Labor. So here's someone so dumb.
There's
that's what I enjoyed out of the whole conversation.
FBI says that I can speed. Here, signed by Governor DeWine. I'm going to print me one of those.
It's funny because there's actually spelling errors on the card if you look closely. Yes. But that's just a whole nother thing in itself.
Nice.
So,
and I bothered with law school.
It's amazing the scams we see. But once again, we've seen it all and we're not afraid to attack it.
Do you post things online with what you're doing? Or is that Scam Tracker?
You can follow us on Facebook, on Instagram and Twitter at BBB Cincinnati.
You can't make that up. That's rich.
So yeah, we were able to share some articles that were circulating just saying that it was a forewarning. And then we sent out an alert as well. But the reason I bring this up is due to that nationwide increase in city mandated face mask ordinances. And I know that Ohio just mandated it maybe 30 minutes ago, 15 minutes ago. So once again, information is already outdated. So it moves at the speed of light. And we sent out an alert actually telling our businesses, telling them what to do if businesses come in contact with this card. Now, because this is old news and it's already outdated, we haven't been seeing these. Also, it got shut down immediately by the Americans with Disabilities Act and even the Department of Justice, even though they don't really coincide.
Well, yeah, but that's illegal. So the DOJ, I don't know.
Mhm.
They're busy with other things over there.
Right. It's a bit, yeah. So though we haven't seen anything, at least in the Cincinnati area, it just kind of brings up that point that businesses and consumers should know their rights, and making sure that their staff and their clients, they have common sense and their safety is their most important priority. So that's just kind of an example of making sure that that trust is established within the marketplace. And it's really incredible.
You have a lot of interaction with businesses and the public, don't you?
Yes, both.
From your firsthand, because I love this, the BBB here, okay?
Yeah.
Is the epitome of the connection between business and people. What are you hearing? I'm just really curious what you are hearing at the BBB as to people's opinions on masks.
So on masks, we have Better Business Bureau has no legal authority, but we are listening to government ordinances as quickly as we can, as closely as we can. Even though we are in the office, we all have face masks, we social distance, we clean every surface we touch. Safety, once again, is that number one, and health is that number one aspect. So if maybe they, thank you. We have a really great team here. And I think that it just shows that office camaraderie, and it's a really great team. But we haven't really seen, aside from that phony face mask card, we haven't seen face mask complaints, because I think people understand that it's for their safety, it's for other people's safety, and safety comes first, then business can follow after that.
Interesting.
So it's really interesting. And once again, we play it day by day. But something we have been seeing a lot of are unemployment scams that have been caused by COVID, because so many people are working through unemployment.
Oh, working a regular job and then getting reported for their taxes, and they're getting unemployment?
All the things. So even though we are still working, we are working through unemployment, whether you are coming back, maybe furloughs, all these different variations of unemployment. People go and try to find work. And since maybe some people are staying at home, quarantining, they try to look for remote work, which is definitely gaining popularity as people have more access to technology. So once again, scammers are right up there, and they're staying up to date, and they're scamming really innocent people. So, and once again, I do want to say that I never want to scare anyone. I never want to make anyone feel uncomfortable, but I just want to make sure that consumers feel safe. And everyone is really smart when they're in the marketplace, and they know how to protect themselves. That's my number one priority.
What's really nice is the BBB is there. You have programs in place. So if a consumer does have any questions or needs some guidance, even if it's not something you guys directly work with, you can always provide that. And Scott, I think one of the most important things she said early on, in that you and I have been trying to preach to the viewers, is that if a company doesn't have a policy for the type of work that they do and how they approach this whole pandemic, whether it's with the consumer or even with the individuals on site, they really need to be putting that in place. So that's a big takeaway from Sarah's presentation.
And at the first week. Pandemic. And that's absolutely right. I was on the phone with a client this morning that is virtually lining up to be lunch. ADA violations, FMLA violations, and their families first violations. And I'm just like, you seem to think that this is something that's going to be over here right quick. And I will promise you that this is going to go through the end of this year. And I would bet you money that December 31st deadline is going to be extended into next year.
And that's been a question for many of us. Sarah, thank you very, very much for that presentation. I'm sure we'll probably be talking to you again later here in a couple months as more starts happening, as you know, because again, Scott's reminding us this deadline of pandemic is December 31st. So who knows what people will think of to start doing.
Who knows? But just in the meantime, we always recommend people to contact their Better Business Bureau. No matter where you are located, there is one all over the United States and in Canada as well. We have really great relationships with the FTC, with our local police department, with so many different avenues, so that people, or with our Attorney General's office. with Department of Transportation, so many different avenues that we should really be a #1 resource for people to find where they need to go. And also Scam Tracker, again, it's such a great tool. Well, with unemployment scams, I was saying that we were able to identify unemployment scams being the riskiest scam of 2018 and 2019 for the past 2 years. So as people are working for remote, we were able to identify through Scam Tracker all these different unemployment scams. So just remember, make sure that what you are finding is legitimate. Maybe just try to do as much research as you can, look for job descriptions that are legitimate through actual websites. And if not, just report it to Scam Tracker. And that really helps us let everyone else know and how to make sure that consumers can take proper procedures to stay safe online.
That's great.
Thank you. Thank you very, very much.
Of course. Well, thank you so much for having me, Pandy. I love being here and I look forward to talking to you soon.
We'll have you back.
That was great stuff.
People are too interesting. They'll come up with something that we're going to need to know about.
There's something, and we are always here. So thank you, everyone.
Thank you. Oh, so you brought up those two major main topics, ADA and FMLA. Scott, you just can't stop pushing those buttons. That's the perfect segue into our next presenter.
Yeah.
Cortot Health has been around since 2014, located here in Cincinnati. And I'm not real familiar with all their main products, but let me tell you, when I saw a back to work tracking system that they have just put together, I called up the marketing team that's representing them and said, hey, I would love for you to come and talk to our viewers more about this. So today we've got Laura Venerable, Senior Director of Products for Cortot. And Laura, I told Scott, I said, Scott, you got to come on the show, if nothing more than to hear and help Laura better understand how what kind of an impact this is going to have, because I know it's a new product. How did you even get to this point of doing the tracking system?
So that's kind of an interesting discussion, because Cortot has been in business for a while, and our main kind of line of business was this tracking system in healthcare that allowed nurses to help people manage a complex disease process. So if you have, for example, God forbid, a diagnosis of cancer or a spinal problem, this system helps the nurses that are, keeping track of you, kind of keep you on the care path to hopefully get you to a better outcome. And we have a kind of a configurable disease platform, so that what oncology care navigators need to manage is different than what cardiology needs, is different than what ortho needs. So we're able to kind of swap out what we call like some disease templates that allow that to look like it speaks different languages to the users. This configurable platform about 2 years ago allowed us to get involved in the community response to the opioid crisis. So we went to some meetings looking to volunteer our time, not really thinking that we were going to be a technology play. We were literally just looking to see how we could, some of our staff, how we could help out in that. And one of the things that came out of that was that the people out in the community that were helping these survivors of overdoses needed some of the same things. They needed to keep track of what clients they were interacting with, how many times they were interacting with them, what was going on in their lives that was keeping them out of treatment. And we were able, because of the configurable nature of our platform, to kind of make it look like the system knows all about managing opioid survivors. And we were, I guess it was maybe the end of March, we were talking, in the office of, okay, eventually we're going to have to start reopening. What are businesses going to need? And we sort of realized they're going to need to do some of the same things. They're going to need to keep track of their employees, and they're going to need to know where they are on a spectrum of exposure to this disease. And they're going to be concerned with things like safety and documentation and retention and all those things that were sort of native to our platform and the systems that we already had in place. And because we could configure various workflows, we literally put this system together using various parts and pieces that we already had to help businesses keep track of their employees as they go through the spectrum of assessing where employees are, whether or not they've been exposed, are they in home isolation, or are they, hopefully cleared to work in the workforce. So, it really was sort of an opportune of the moment kind of thing. And the way that our software was configured allowed us to kind of get into that space. Now, I know you guys have talked before that, HIPAA doesn't necessarily come into play when we're talking about back to work and collecting employee symptoms and things like that. But our platform, because we are used in a healthcare environment and healthcare space, is HIPAA compliant. It does understand how important safety is, about maintaining the safety of that information, about a need to know on particular elements. And so that's already an embedded part of our platform.
And Scott and I have tried in the past to stress with our viewers, because so many of you, we've got viewers today from Texas and Arizona and Colorado and such. Each state has different requirements for that pre-screening or that back to work type of requirement for the employees. So your program is, again, nationally oriented. It will adjust, or you can customize it.
Absolutely. So it was all of those tools that we already had in place that, allowed us to be in healthcare and in public health. All of those things kind of help us configure particular workflows, configure particular survey questions to adapt to whatever that state's requirements might be, or even what that business requirements might be. So we know that there's no one size fits all in how you bring employees back and how you keep your workforce safe. So it's essential that you be able to kind of reflect that business's plan and that business's procedures. And we have the kind of the configurable technology that allows us to customize that, not only according to kind of national guidelines and state guidelines, but down to an individual company as well.
I'm thinking here, when you mention HIPAA, HIPAA is about the highest standard you can get.
Yeah.
Just, for our folks out there, HIPAA is whenever you get something from a doctor, third-party administrator, or an insurance company. But you're set up that if somebody wants to keep all those HIPAA requirements in place, they can do that.
Right. And we're finding in some cases HIPAA may come into play when you're talking about back to work, when you have organizations that are covered entities or need to be HIPAA compliant are the ones trying to get their workforce back to work. One of our first clients or customers on the platform was an organization that's a congregate care facility. So they run homes for people with disabilities that live there. They provide services directly to them. So they were trying to manage not only their employees being safe, but also their residents and their visitors being safe as well. And in that case, having a HIPAA compliant platform was very important to them in that case.
Yeah, because in that case, and Pandy, you make a great point. You go from state to state. There's a big difference between standing in Ohio and maybe driving into West Virginia, driving down to Virginia. So, and I'm finding it very difficult, unless it's a public sector employer. If it's an employer of 500 or more, they're in multiple states. So put it this way, if I'm sitting there running one of these things, is it pretty safe to say that if I'm complying with your HIPAA platform and everything, I'm going to be pretty good wherever I am?
You are. And because we've been dealing with data at a scale for so long, this sort of just comes naturally to us. So, a lot of times when we're starting to talk to customers about getting back to work and what are your plans, a lot of them are saying, well, I'm just going to track this in a spreadsheet. And, if you are like you, Scott, a sole proprietor, okay, fine. Use your spreadsheet, to keep track of, whatever it is that you might need to do. But once you start talking about, organizations at any kind of scale, you're going to outgrow a spreadsheet really, really fast. When you start talking about, daily symptom assessments, let's just say I've got 100 employees. Well, if 100 employees are reporting daily symptom assessments, okay, that's 500 a week. That's 2,000 a month. That's for the next 12 months probably that we're going to have to be doing this. Start at what point, does it just become overwhelming to try to manage this all in a spreadsheet? And that's, kind of the spot that Cortot fills in getting back to work and helping companies with large workforces kind of keep safe, is that we understand the differences between the different states. We are HIPAA compliant. We can configure this to your particular workflow. And that kind of data collection and data management is what we do all day long. It's not like we wrote this specific for back to work and it's an untested platform and we've only got one customer on it. We have a lot of people using our platform to do case tracking and case management across a lot of different diseases and specialties. And that's one of the things that we bring kind of to the platform is knowledge about how to do data management correctly.
Because that's one of the things when Pandy and I were talking before, there's a few things that come up in this. Like my clients right now are dealing with, and of course there's the OSHA stuff. And, like you folks, I know like Pandy, I put a lot of stuff out there. And actually I rearranged my website so people can just hit on the big germ. All right. And then the big coronavirus takes them to all that stuff there. If I've got folks, I'm taking their temperature coming in, or something like this, and sure enough, there's somebody that has 101 temperature or something like this. I can use this system because I'm going to send them home. I can use this system to enter Jane Doe 101 temperature, and this can go into this protected system and track Jane.
Exactly, right down to the employee, because we want to make sure, to keep your workforce safe and healthy, you have to get all the way down to individual employees being safe and healthy.
Yes.
So we help keep track of Jane, whether she's healthy or symptomatic, because it's important to know both of those things. It's important to know that all week long, Jane's been saying, I'm not symptomatic, I'm healthy. I've done all of the appropriate social distancing and safety things that I need to do. So you need to keep, a record of not only when employees are sick or exposed, but also when they're healthy, so that as we go through this and you have questions down the line, or God forbid, litigation down the line, and you have to prove what you did, you already have a system in place that has all of that documentation available to you.
And this is easy.
It's easy. Yeah.
Yeah. Because I'll tell you, and Pandy and I hit this all the time. I'll tell you, if in employment law, and I'm rather cynical, I've been an employment attorney for 25 years and I've been an HR person for 40. Okay. So I'll tell you, I'm very cynical. When you go to court, the truth doesn't matter anymore. It doesn't matter. No, the truth is the first thing to die. What can you prove?
What can you prove?
If it isn't written down, it didn't happen.
Right. And so what we're advising is start now. Don't wait until, the court case has been filed and you're trying to reconstruct what you were doing 6 months ago.
We call it fraud. Yeah, that's like, who better be doing that? Yeah.
Start now, put some simple, mechanisms in place. We can send outreaches to employees using text or email on a daily basis. If that's what you want to do, we can support that kind of schedule.
Really? So I can be at home, and this is something that would automatically generate to me, hey, Scott, you look like you were dying yesterday. How you feeling today? Something a little prettier than that, but. And
we can adjust it based off of where you are, Scott. So
that's why I don't write these things, but I'll tell you, I referred a client to an insurance carrier for exactly that reason. It is this one carrier I'm working with. It is the most sophisticated system for and that's the thing, communicating with these employees. Like right now, somebody is maybe off exposed to COVID. They're not on their COVID vacation.
Right.
They're off because they've got this, and you should be communicating with these people. And when you stop communicating with these people, lawsuits, unions, okay, they don't care about me. And this is something that this is geared to do.
Absolutely. The other thing, I don't know if you talked about it before on the show, is so the ADA now allows you to ask various symptom types of questions because we're in a pandemic. It's a
while, yeah.
Yeah, it's been a while. Maybe uncomfortable, and it's not just, you're not just asking symptoms about that employee, you're asking about symptoms about members in their household, which is a little bit kind of invasive. So communication is important, but those ADA regulations require that when you ask that medical information, that you keep it on file. I think it's for a year. So
you better at least.
Well, I think it's regulated for a year, but you're right. You better keep it longer.
Yeah.
So, trying to manage this on paper or in spreadsheets, I think, any company of size is going to, run into a wall fairly quickly.
Spreadsheets are my way of keeping track of my taxes when I used to put my stuff in shoe boxes.
Yeah, right. And we have a fully functioning platform that really is geared towards the complex kind of case tracking, but done in a very simple and comprehensive type of way.
What is your website? Because I'm like, this is really cool. What is your website?
I didn't catch that.
Your website. What is your
website? Oh, it's cordatahealth.com.
How do you spell that?
We have an CORDATA health.com.
Cool.
And we have an entire page and a resource center associated with Back to Work, because one of the things that we think is important is, this isn't just a technology play for us. We also want to be a resource to our customers and to businesses trying to get back safely. So we have some resources that are available on the site, like the top 10 mistakes to avoid in compliance. So we have an ebook on some of the things that we're hearing, and some of the consults that we've done with lawyers and people in the labor department about what's important in this area. So we offer those kind of things as resources. We do a weekly webinar on things, and sometimes we have panels of people like this show where we're talking about a particular area. Sometimes we do a demonstration of the platform for people that, it sounds too good to be true that you could track this detail and it's still simple, but really it is. It's simple, and we've made it as simple as possible while still being compliant with everything that's coming out from the CDC and the Department of Labor, and all of those, various public health type of organizations. So lots of resources on our website for people to go to.
Well, Laura, I think you haven't said, which I think I need to kind of chime in and say, is that this whole program is very, very cost effective when you start thinking about taking when I'm thinking about 1,000 employees. When I worked with Mercy Health Partners, we had 2,300 employees. If we had to track the health condition of all 2,300 employees, I would have had to have used at least one, if not two FTEs, on a full-time basis, to get all that information if it had not, if I didn't have the technology that you have. So from a cost effective, a company really, if you've got 500 more employees, you really need to look at how much it's costing you to keep track of that information and just what liability you are putting yourself at risk for. I also wanted to just make sure everybody understands there's a turn right now throughout the country where a number of states are starting to stand up and start flipping the terms and conditions for workers' comp claims right now. And there's like 9 states that are still standing firm saying, no, we're going to make sure that we side with the businesses in regards to whether COVID's actually acquired in the workplace. And yet there's another, I think I've got 12 states and Kentucky is one of them, who's flipping it and saying, you know what? No, we're actually going to side with the employee, and it's going to be the burden of the employer to prove that they've done everything they should have done to help prevent COVID and the spread of COVID within the workplace. And Kentucky is one of them, and they're siding with the essential workers. So this is scary, guys. Back in March when Scott and I were talking about this, we were saying tort claims really were going to be a major concern. That'd be very difficult to prove a workers' comp claim associated with COVID. I told you last week that I've had my first employee pass away from COVID for one of my clients. So, and Scott has told you how real this is.
Mm-hmm.
If we've now got states, and this is not just California, this is Florida, Illinois, Kentucky, Minnesota, Missouri, New Hampshire, New Mexico, North Dakota, Utah, Washington, Wisconsin, Wyoming, Alaska. These states are starting to roll a little bit and side with the employees. Information, well, let's see. Scott, what's your favorite phrase? If you don't document it, it doesn't happen.
If it isn't written down, it didn't happen. And you listed blue states and red states.
Yeah. This is amazing. When I get these kind of bulletins and I start reading this stuff, I think, oh my gosh. And again, our viewers are all over the country right now. So if you've got employees in other states. You need to be aware that you have to abide by those state laws. You cannot, just because you're in Kentucky or West Virginia or Illinois, you can't just hold to those state laws. Laura, thank you so very, very much. I just am so thrilled that you had an opportunity to spend some time with us today. Again, I want to invite all of our viewers to go to cortothealth.com, correct?
Yep.
I've been on there. I've gone through the back to work tracking system site. Both were done very, very well. And as we encourage all of our viewers, if you have any questions, reach out to Laura. She will be more than happy to answer your questions specifically. And a demo, why would you not want a demo? I mean, if you've got 500 or more employees, for crying out loud, give these people 20 minutes and do a demo so that you know what your options are. And it's just kind of silly when you've got all this unknown stuff. Let me back you up a little bit though. I want you to here's what I want you to do. If you're a viewer and you've got 500 or more employees, I want you to do a budget check. I want you to see just how much it's costing you right now to have somebody track this information. And then I want you to check the security of that, because we've told you over and over again on this show how important security is in maintaining information and where you're storing and keeping it. And then I want you to check your policies, because again, I know, Scott, laugh at me.
Before they're subpoenaed. Yeah.
And remember,
if you're not requiring your employees to self-report, then you need to require that you're taking this information. So, before you introduce any additional processes or protocols, get your policies in place so that somebody can't refuse to take their temperature, or they can't refuse to give you this information for the betterment of the company. Remember, the needs of the business come first.
And the other thing I'll say, Pandy, is as you're going through that process of assessing kind of where you are and what you need, don't forget that you can't include all this information with your regular HR and personnel type of files.
Exactly.
That the ADA requires a separation between those two things. So you can't just slam it into your existing HR or personnel type of system. It has to be something separate.
Well, and what we tell, what the viewers have been told here is we don't want it even in the medical files.
Right.
So we want it in a COVID. So remember, we've told you over and over again, we want you to have a COVID drawer, COVID, a COVID file. That's where this information goes. It does not go in, as Laura said, in the personnel files, but don't even put it in their medical files.
Right. And this isn't just for this year.
Yeah.
I mean, understand the world has changed like 9/11.
Yeah.
Okay, it's changed. Viruses, for the rest of our lives, you will always see some people wearing masks.
Yeah.
Okay, so, there's all kinds of talk. Oh my gosh, my wife got my attention yesterday when she was saying that there's supposedly the bubonic plague making another comeback in China. And I'm like, I don't know if it's true, but I'm hoping not. But there will always be a need. And Pandy, you hit it on that workers' comp thing. That's a punch in the face. Yeah. But understand, every company in this country is, well, if your public sector has their own type of thing, but private sector companies are all covered by OSHA. And one of the worst things that could happen is OSHA shows up. You are not following their guidelines, which have been in stone for 2 months now. You're not doing those things. And even if you are doing those things, I don't have a record of it. I mean, get out your checkbook and you could hit, you're going to hit 5 figures or 6 figures, or not 6 figures, but you're going to hit 5 figures, 6 figures pretty quick.
So let's go ahead.
I was going to say, I think what the pandemic has sort of made us more aware of than maybe we were is just maybe how exposed we are to some of these viruses.
Yes.
Whether it's a nursing home or the jail or a meat packing plant. I mean, we never really worried about it much. And I think now we've sort of become more sensitive to the fact that it can have a real impact on business operations.
Yeah. And don't forget, just like you mentioned, and Pandy too, I was on the phone with a couple of clients this week. The number of FMLA and ADA violations, it's a record. I mean, be forewarned, those laws have not changed, for substantially. They're still there. And I mean, I'll tell you, I've spent a lot of time producing videos because I've got so many clients that are just forgetting that these laws are there.
Yeah.
Don't
Yeah.
do that.
And let's caveat off of there. Laura, again, thank you so very, very, very much.
Yes.
Really appreciate the information. I want to keep following you here over the next couple months to see how well that program is doing, because I know you're going to tweak it. I know you're going to keep making it better. I think I've talked to you in Simca enough to know that this is just all the way. Labor law changes, and Scott, my gosh, I cannot remind, and I know this isn't necessarily COVID, but I'm just so compelled. I have to remind all of you, if you are in charge of your HR policies, please, especially if you've got employees outside of Ohio and Kentucky, I am reading up on a number of states that have got new laws that are going to start here July 1st. Chicago, Washington, D.C., they're putting in paid family leave acts to go above and beyond what FFCRA is doing. And you've got to be aware of that. Again, most of my clients only have one person here and maybe 3 people over there. And so they're not as focused on these other states, but you have to be. You absolutely have to be. So again, as Scott and I have said, if you aren't us,
Yeah.
call us. Let us know how we can help you. You're going to love this next one. I actually was at a client yesterday, Scott, and nobody's there. Okay, there's one person in a building that normally has, 40, 45 people. I was flipping lights on, going, what in heaven? This is a dungeon. But then I went over to get a glass of water, couldn't find glass of water, and I looked over and I thought, oh my gosh, it looks like they just left and wasn't paying any attention. So I started going through their pantry. So my question is to our viewers, how many of you have gone back to your pantry or your kitchen, your break room, and opened up the kitchen refrigerator? Let me tell you, what I found was not a pretty sight.
I'll bet, yeah.
And I found 32 boxes of energy bars, and some of them have been expired over a year ago. They expired back in March of 2019. So not only have we just not paid any attention since March of this year.
Yeah, really.
Oh my gosh. And Scott, I remember when I had 15 stores of a major retailer, they didn't have any HR on site. So I was always checking the break room to see how clean the microwave was and make sure that stuff was working. And people would get upset if they thought they had been exposed to mold or some kind of a fungus growing on something. So my challenge to our viewers is, hey guys, when you keep the lights out and the rooms are not inhabited, guess who does come in and move in? And if you've got a break room that has crumbs, or I found an open bag of almonds still sitting there, guys, you're just asking for pests and mice and all these things to come into your space. So please, not only go in and talk about your chairs and your sanitation, would you please go into those break rooms?
Clean the place. Really, isn't that tough? Clean the place.
It was an interesting one, I think. Hey,
Yeah.
Want to remind everybody that if you have a 401k or a simple IRA, July 2nd, the IRS came out with an update that they're going to provide a relief for mid-year reductions to safe harbor contributions. Please, there's another expert, we tell you over and over again, get with your 401k administrator and find out. Those are notices 2020-52 and notice 2020-51. Find out what that's going to be, because that might be a great advantage for you to save some money and be able to put off some contributions. Scott, did you hear about the field assistance bulletin in regards to the FFCRA programs in regards to summer camps?
Summer camps. No, I saw a flyer on it on my email, but I didn't read it. But
well, Department of Labor put out a notice 2020-4 on June 26th, and I meant to mention this last week, but I forgot. Remember a couple weeks ago we talked about FFCRA programs are not geared for mommies wanting to stay home and stay at the pool with their kids. They have to show some effort in trying to find daycare because the schools are closed. Remember, the program was set up to help when schools and daycares closed for the beginning of the pandemic. Well, now they've kind of loosened up those terms, and if your child's summer camp or summer school or one of those kind of structured programs has been closed or has been prevented to be opened, that will qualify for the FCRA program. Now that's at 2/3 compensation, obviously, and it's for a limited time, but look up that guidance and read it over very carefully if you've got some individuals who have.
I will look at it now. Yeah, I was a summer, when I was going through college, I worked 3 jobs. I was a day camp counselor during the day. I worked at a movie theater at night, and I was a DJ at a country station on the weekends. Okay, or in the evenings. Yeah, daycares, that makes an awful lot of sense. Camp is a place where the kids go, where there's supposed to be adult supervision, and we call them counselors, which was me. But that makes a lot of sense because that is exactly, the parents would drop the kid off in the morning, and then after work they'd pick them up, and that makes a lot of sense. I'm surprised someone thought of that. That's really great because we were a babysitting service that did stuff during the day. So that qualifies now, huh?
Yeah, it does. I was really thrilled with that. Also want to remind all of our viewers, if you have a company associated with construction, OSHA has come out with some new guidelines in regards to face masks for construction. Now, don't try to take your company and fit it into the construction just so your people don't have to wear masks. That's not what this is about. But it does give you some leeway because we've talked about dust and concrete and then all the garbage that sticks to these face masks and the type of face mask that should be used in these kind of situations. So please go to your OSHA guidance update on that. Again, it's constant change. And today's show was phenomenal in that it reminds us that if you don't have a policy that's specifically addressing much of what's going on right now, you need to be putting some stuff in place. But a question came up the other day, do they have to put this in their handbook? No, you don't have to put it in your handbook. Just because you have a policy doesn't mean that it's automatically in your handbook. It might be a standard operating procedure. It might be an SOP and not an employee actual policy, but make sure it's posted. You have the responsibility to make sure that this information is distributed and communicated equally and evenly. Yeah. So as long as it's on the bulletin board, you're mentioning it at your safety meetings, you're talking about it in your management meetings.
Talk about it.
Yes.
Yeah. You're right.
Well, I can't thank everybody enough. Scott, again, thank you for coming. I'm sorry we didn't get to the ADA today. The day went really, really fast. We'll have to catch you next week. And again, viewers, send me your suggestions. Tell me what you want to hear. Tell me what you need to hear. Again, we try so hard on this show. We're so blessed to have ICRC-TV and their support on this information and the things that we've been able to accomplish on here. And you, as viewers, I just can't believe, I thank God every day that you're giving us the positive responses that we're getting. My name is Pandy Pridemore. I'm Principal Consultant and Founder for the Human Resource USA. I want to thank Sarah and Laura and Scott for one more great week. And viewers, thanks for coming back. We'll see you next week.